Hi everyone, this is Dr. Pham from Arbo Dental Care. I hope everyone is doing really well. I want to try something a little bit different and start showing a lot more of what I see on a daily basis. So I wanted to start with this photo here, where we're starting to see quite a bit of a little bit of a cavity starting here, and the main complaint that the patient had was that they were getting food stuck and they were starting to get a little bit of discomfort and pain from it as well. A little bit of cold sensitivity too. And it makes sense why when we look at this photo is because we're starting to see a little bit of a hole right inside the tooth. And it's to the point where a small portion has started to fracture there as well. So what we ended up doing was we took an x-ray, and I'm going to show that now. We took an x-ray, and this is what we see when we take a look at the x-ray, is that this is the tooth that was causing the discomfort. So what we're looking at here, and hopefully a lot of you have been able to go through the x-rays with your dentist, but what we like to do at dental office is that when we see an issue, or even when things are normal, we like to go through the x-ray as well. So I'll quickly go over that now. This is the last molar in the top left for the patient. And what I usually look at is where the bone level is. So the bone is right across here, and it is down here right on the bottom. And if we draw our attention to the tooth on the bottom here, we can see that this is a pretty normal looking tooth. This is great. This is what we want to see. And what I'm outlining here is the enamel of the tooth and the nerve of the tooth, which is on the inside here. So if we do the same for the top, what we're starting to see is that there's a shadow right here, and it's a pretty sizable shadow. It's almost a quarter of the tooth, and we can see the enamel is still very well intact, so that makes it even more clear what's going on, which is when a cavity starts and it breaks through the enamel, it doesn't take it very long to start eating away at the part of the tooth underneath. And that's what's happened here, and that's why they're experiencing so much sensitivity, because the nerve is very, very close. Most likely it's already contaminated with the bacteria, and so it makes sense why they were feeling a lot of sensitivity. So we went ahead and we started doing the filling for this patient, and this is what we see when we initially do the opening of the tooth. And just to orient ourselves here, this part of the tooth is all decay that we removed after this photo. We didn't leave this behind. This isn't the final procedure. What we ended up doing was that this decay this is very dark brown, and that's how it looks like. When it gets really discolored, there's usually an issue, and we usually look at the tooth next to the one that we're working on as a comparison. You can see a little bit of discoloration here, but this is all very normal. Anyone that drinks coffee will have stains in some part of the tooth like that, but it should never be as dark as what we see in here. And so what we usually do is that we remove as much as we can, and we be mindful of how close it is to the nerve, and we try to stay as far away as we can. After we removed the bulk of the decay, we did the filling. And after the filling, we called the patient the day after, and they did so well. We were very fortunate in this case that they haven't experienced a lot of discomfort, but I always warn ahead of time that it's most likely going to be an issue. So how do we avoid these issues long term? This was a new patient that came in after 5 years at least before seeing a dentist. So they weren't seeing a dentist regularly. I would say every year, please go and just see your dentist just to have a checkup, possibly x-rays, and just to take a look at your gums as well, because these issues can be avoided. And it takes a lot of it takes a long time for a cavity to break down the tooth. But once it does, it starts to accelerate, and that's what likely happened here. We don't have previous x-rays because this patient didn't go to the dentist regularly enough. So hopefully everything goes well with this patient. I hope everyone learned a little bit and it wasn't too bad. Let me know if you like hearing about what we see, and hearing our consultation, because I'd love to do more of it as well. All right, thank you and take care.